Welcome to another edition of the Ministry of Health's Week in Review. On Friday last, the Honorable Minister of Health, Dr. Frank Anthony, attended the highly anticipated launch of the Guyana Coursera platform. Through this initiative, the ministry has been able to roll out at least 3 categories of its nursing program using the hybrid approach with Coursera. Currently, over 1,000 persons are enrolled in the various programs. Meanwhile, on March 24th, Dr. Anthony conducted a walkthrough at the construction sites of the regional hospitals and general hospital being erected at number 75 Village, New Amsterdam, and Bath during his visit to regions 5 and 6. Thereafter, he attended the Besant Oosteve at the lawns of the State House in New Amsterdam, Berbice, in which His Excellency President Dr. Irfaan Ali hosted a celebration of the season of Holi. On Tuesday, the health minister received a generous donation of 500 units of Holly Branch baby and toddler multivitamin liquid from Massey Distribution, valued at 700,000 Guyana dollars. Dr. Anthony, in thanking the organization for the donation, said the items will support the ministry's ongoing school health program.
We have an interesting program that we started in the ministry, and that is to screen every child, school-age child, and we want to make sure that they're healthy. So we've started at nursery. We've screened probably about 12,000 children, and we are completing that screening this year, and then we go on to primary, and our target this year is to complete it 7,000 children. So while we're screening them, we're checking different things: hearing, sight, dental, and a general checkup. So if we see anything that is abnormal, we want to pick that up early and fix it. And in some cases, we see kids that are might need different type of nutrition or some help. So I think this would work well for that particular school health program.
On the following day, he then met with Dr. Rachel Verman, Director of the Global Health Department at Mount Sinai Health Systems, to discuss and identify the next steps for child screening as part of the school health program. Thereafter, Minister Anthony journeyed to Region 10, in which he commissioned the region's first dental unit, valuing Guyana $7 million for rehabilitation and $50 million for the procurement of dental equipment and supplies in Christiansburg. While at the event, he said that the ministry aims to enhance its infrastructure by providing more equipment and train additional personnel to facilitate these improved services.
Every year, we have set ourselves a goal to make sure that in every region, we build out capacity, both in terms of facilities, in terms of equipment, and of course, making sure that we have adequate personnel so that we can utilize the facilities that we build.
On the said day, Minister Anthony also commissioned the new Simulation Clinical Skills Lab at Linden Hospital Complex. This lab will aid in better preparing healthcare providers to handle any challenges they may face when providing realistic care. While delivering his remarks, Dr. Anthony noted that with the new hybrid approach to learning, the ministry has also worked with other agencies to update their curriculum and develop centers. While within the Linden Hospital compound, Minister Anthony also commissioned a newly refurbished ambulance station valuing some $80 million. With this new and improved facility, it is expected to be fully equipped with the necessary amenities that an ambulance station should have in cases of emergency. In wrapping up the Health Minister Day of activities in Linden, Dr. Anthony attended the graduation ceremony for the region's first batch of community health workers at the Major's Reception Hall. These graduates are now expected to return to their respective communities and apply the knowledge and skills they acquired during the last 6 months of training. In congratulating the graduates, Minister Anthony noted that a few of the graduates were chosen from the riverine areas so that they can render assistance to patients through the telemedicine services.
In the selection of this batch of students, You would have seen that we have taken time to choose people from the riverine areas and areas that are currently underserved. And that was not by accident, it was by design, because we want people to go back in their community and serve.
This has brought us to the end of this week in review. Until next time, stay safe and protected.